I'm Ms. Megan, I'll be your student next time. Close this curtain to provide privacy. Wash my hands with proper hand hygiene. Can you tell me your name and date of birth, please?
Taylor Lutz, May 27th, 2001.
Okay, do you have any allergies?
No.
Okay, verify that on your D-band. All looks good. And do check and see what we're doing today. We're gonna do your blood pressure, apical pulse, and general survey. So I'm just gonna explain that to you as we go, and I don't need any gloves today unless we come into contact with bodily fluids or any infection control. So first we're gonna start with your blood pressure. Rotate that like that. Start by seeing when I feel your pulse. I felt your pulse at 140, so we're going to pump it up to 160 when we do your blood pressure. Normally I'd wait 3 minutes to let your arm relax, but for time purposes, just head right into it. I got 122/70. The normal range is 120/80, so you're within normal limits. So next we're going to check your apical pulse. So we're going to go down your ingoli over the second intercostal space and the midclavicular line, and then down to the fifth intercostal space. That's where we'll heal your apical pulse. Now ingoli, second intercostal space, third, fourth, fifth. I got 72, which the normal range is 60 to 100, so that's within normal limits, so that's also good. So next we're going to move on to your head to toe assessment. I'm just going to check out your hair, checking moisture consistency and color, which it all looks good. I'm going to feel your scalp if that's okay for any abnormalities or nodules. That all feels good. So then look at symmetry of your face. Make sure everything's level, looking at the color, take a look at your nose symmetry, make sure there's no drainage. If there was, I would note that. And then I'm going to take a look at your patency, so you can press on one side, suck in, and check on the other side. So that looks good. And I'm going to take a look at your nasal cavities. That looks good. Can you pull down your bottom lip for me? And then your upper lip. Okay, those look good. There's no sores, so I'm going to take a look at your teeth and gums. And then look at your tongue, and then if you say ow, look at your oropharynx and tonsil. And that all looks good. So then we're going to take a look at your skin, looking at color, moisture, check the skin turgor, which all feels good. Check your nails and the capillary refill, which does within 3 seconds, so that all of it is good. I'm going to check for edema on your legs. And the edema scale is level 1 is 2 millimeters, level 2 is 4 millimeters, level 3 is 6 millimeters, and level 4 is 8 millimeters. So I'm going to check for signs of phlebitis on your arms and your major veins, since we can see those. and there's no signs of phlebitis. If there was redness or warmth or swelling in a localized area around a vein, that would be signs that we need to check out for phlebitis. And then we're going to move to your muscles. So I'm going to test your neck muscles. If you look to the left, and then look to the right, and then your deltoids, arms out like a plane, push down, push up, shrug your shoulders for trapezius. Okay, and then if you cross your arms like this, I'm gonna check your grip strength. And then spread your fingers out like this, and squeeze them. And then we're gonna do abduction. If you push your legs out, and adduction in, and then pull out, don't let me for your hamstrings. And then for your joints, let me know if any of those are sore. Knees. Any of that sore? No. And it doesn't look like you have any muscle tremors either, so that's good. So we're gonna move on to your eyes. So do you have glasses or contacts?
I have both.
Do you have any history of glaucoma?
No.
Any cataracts?
No.
No. Okay, so I'm just gonna look at the external structures of your eyes, so your eyebrows, your eyelids, and your eyelashes. That looks good. Now symmetrical. So I'm gonna take a look at your pupil accommodation. So I'm gonna stare at this object. I'm gonna pull it down and look straight forward. I'll see if your pupils accommodate. Okay, and I did. So now I'm gonna check your pupil reactions to the light. And take a look at your other eye. Make sure it's constricting equally. And it is. So next we're going to do your visual field. So let me know when you see the object. And we're going to take your 6 ocular movements. Just follow the pen. Okay, with that we're just checking to see if your eyes are tremoring or anything along that line. So if you pull your eyes down for me, I'm going to check your conjunctiva and sclera, and then pull them up like that. And those look white and green color. So next I'm going to check your hearing. So have you ever had tubes in your ears? No. Any hearing loss?
No.
And any earaches? No. Okay, so I'm just going to examine the outside of your ear. Make sure it's good in color. I'm just going to kind of color it a little bit. All that. And then an otoscope, I've looked inside your ear, tympanic membrane, and it should be a pearly gray color. So I'm going to have you close your eyes and then check your hearing and let me know what ear you hear this in. Okay. Okay, good. Alright, and then I'm going to move to your neurological assessment. So I'm going to ask you, can you tell me your birthday again?
May 27th, 2001.
Okay, and do you know the month?
Right now?
Yeah.
November.
Okay. And do you know where we're at?
At our apartment.
So let's just let me know that you're orientated and you have good memory from asking if you had hearing loss and other questions from before, so that's good. And then I just want to see if you can stand up for me. If you can walk over to that wood door and back. I just want to check your balance and your gait, make sure you're not struggling with anything and you're balancing well. Okay, and then I'll have you stand and face me. And if my hands like this, this is a Romberg test. So sit down. I'm just making sure you're not swaying back and forth and hitting my hands. You have a good balance with that. So I'm going to check your nerves. So we already did the oculomotor, the oculomotor, and abducens, and the trigeminal, and the optic nerve, and the auditory nerve with your eyes and your hearing. So we're going to move on to trigeminal. So whenever you close your eyes, and let me know what part of your face I'm touching.
My cheek.
Okay.
My chin. My forehead.
Okay. And then we're going to do your facial nerves. So can you smile for me and frown and raise your eyebrows? Okay, so that all works well. So I'm going to have you do the glossopharyngeal, so open your mouth for me. And then I'll stick this in here, like your gag reflex, that would be your vagus. And then your hypoglossal nerve, I'll have you stick your tongue out and wiggle around. Okay, and that works. And then your accessory nerve, I'm just going to be shrug your shoulders. Okay, and that works too. So then that's it for your neurological assessment. So then we're going to move on to your respiratory assessment. So we're just gonna take a look at, I'm gonna have you spin around and have your back towards me. So I'm going to just move here to the side. I'm just gonna feel for any bumps, nodules, abnormalities, things along that line. That all feels good. And then I'm going to have you take a big deep breath. In and out. Okay. And so my hand moved in a W form when she breathes. Breathes. So that works. That tells me that that's working fine. And just judging by the way you're breathing, you're not putting in too much effort to breathe, so that's good. So I'm just going to listen to the 18 spots of your back. So every time you feel the stethoscope move, I'll have you take a deep breath, okay? So starting up here. Okay, and that all sounded good. So I'll have you spin back around in the front. So I'm just gonna feel your chest for any abnormalities, make sure everything's okay with that. And then we're gonna take a look at your 8 or your 10 spots of lung sounds on your chest. So look at your trachea. Okay, breathe in here. That's all good. And then I just have 3 questions for you about respiratory. Do you have any history of COPD?
No.
Do you smoke?
No.
Do you smoke e-cigarettes?
No.
No? So that's weird. So I'm going to do your cardiovascular. So I have 3 questions about that. Do you have any angina?
No.
No. Do you have any abnormal blood pressure? No. And do you have a pacemaker?
No.
No? Okay. So for your heart, I'm just going to make sure there's no obvious pulsations. I don't feel anything. I'm going to check your jugular distension. Don't see any of that. I'm going to check your peripheral pulses. So your temporal and your carotids. Your brachials. Your radials. Your femorals are right here. And then your poplitals. Your dorsalis pedis is down here, and then your posterior tibials is back here behind your ankles. And then all those are present bilaterally. So I'm going to take a listen with the bell of my stethoscope to your carotids. And just have your pulse in. And you can listen to 30 seconds with that. If there's any abnormalities, you would want to listen for 1 minute. And I forgot at the eye and vision part to have you read this card, so I'm going to have you do that for your near vision.
Southwest Technical College.
Okay, you got it. And then also to test one of your nerves that I forgot to mention, we're going to check your olfactory nerve, so I'm going to close your eyes and tell me what you're smelling.
It's like a cinnamon and mellow scent.
Yeah, good job. Okay, back to your cardiovascular. We are going to take a listen to the 6 spots. So we're going to start with your aortic artery, then your pulmonary, Erb's point, tricuspid, mitral, and I'll explain how to get there with each one. So we're going to go down to your ambulogluteus, second intercostal space, and that's your aortic. And then we're going to move down 1 intercostal for pulmonary, down 1 intercostal for Erb's point, and then down 1 intercostal for tricuspid, and diastasis for your mitral valve. Okay, you can hear all those clearly, so that's good. So then we're going to move on to your abdominal assessment. So have you voided before this exam?
Yes.
Yes? Okay, so I'm going to have you lay down on your back. Okay, so I'm just going to take a look at your stomach and I'm going to have you lift your head up. Towards your belly. There we go. Okay, I'm just checking for any hernias, feeling any of that. Okay, so that's good. So I'm just going to inspect your abdomen for symmetry, see if there's any abnormal lumps or bumps that I need to check out, which that looks good. So I'm going to take a listen to your bowel sounds before I feel anything. So there's 4 bowel sounds in 4 quadrants. So we're going to start in your upper quadrant. I'm just going to take a listen now. And then I'm going to take a listen with my bell to your arteries. So I'm going to listen to the aortic artery and then the renal arteries. And the iliac arteries. Okay. So then I'm going to percuss in the 4 quadrants to see if I feel anything. So listen up here. Anything abnormal. Now it feels good. And then I'm just going to palpate. Seeing if I feel any bumps, tumors, anything like that. And then palpate down about an inch, half an inch to an inch. And all of that feels normal. So 3 questions about your bowels. Have you had any constipation?
No.
Any diarrhea?
No.
Any abdominal pain? No, all of that's good. Alright. Is there anything else I can do for you while I'm here?
No.
Okay, so I just document all of my findings, if any of them were abnormal, anything like that. Okay, well done. Exciting.